Which group, which table wants to be the first table sort of reporting out what they found? Any volunteers? Mike? Oh, all right, your reporter's getting some food, okay. How about this table back here in the back? Oh, you're not quite ready yet? You ready? All right, come on up. Whoever's your reporter, come on up. And are you going to be doing the report out? Can we keep it down just a little bit? Johnny Coleman is going to tell us a few of the priorities that his table right up here in front specified. Go ahead.
Hi. First one is public safety, creating a block watch for the neighborhood. Number two is affordable housing, trying to identify or create new affordable housing in the neighborhood. Healthcare, also trying to identify where you can get affordable healthcare in your neighborhood or anywhere. Number four is education. Trying to find affordable education. Also, free education, free training for members of your neighborhood or your community.
Okay, great. Anybody from that group want to add any thoughts or comments about anything? Constance? Oh, I thought you had something to say. It's okay. All right. Let's thank that group for their comments. All right. Good. Who's next? Any volunteers? Not yet. No, they not. You guys? Okay, great. Come on up.
2 minutes? 2 minutes is 2 minutes. Wisconsin's okay. It's going to take 2 hours. Well, the first thing that we felt is a major priority is communication. Yeah. The second thing is health. And the third is employment. And the reason why we chose these three, one, communication, is because I feel as though, and I'm pretty sure my team members feel as though there's not enough communication in the environments that we're trying to help.
What kind of communication are you talking about?
Communication varies on a wide level. Communication can be as what it is right here, right now. Everybody got out their point of views. Everybody, are, very adamant about what it is that they think this project should be doing and where it should be going.
So do you think not only to just get points across, but to actually listen
and understand
and to come up with a concept, a plan, and to execute as well. Because it's pointless to have a plan without execution, and most of the time you need a team. So communication is key to everything.
So are you talking like more community newspapers or?
We talked about people don't know.
Here she's coming with the mic.
The resources are.
Okay.
We talked about it. We talked about
Still not working.
We talked about resources and that people don't know the resources that exist, and sometimes they don't even have the strength and energy to connect with the resources.
Yeah, and some of these people who are the resources and are the assets, some people, companies, businesses, etc., should reach out to the communities more because they have no problem accepting our patronism, if I'm using the correct word, or money. There you go. So they should be able to reach out to the community for resources such as jobs, maybe health benefits or anything that would have a positive effect on the community and its residents.
And to also add the three choices, well, the three resources, and basically they kind of intertwine with each other. The second one we chose was health, and as I stated for communication, that is along a wide scale, because a lot of people look at health as far as bodily. Health can go as far as communication, because with healthy communication, everything else can fall in place.
And with healthy communities, citizens can thrive. Also, as far as mental health, a lot of people have mental problems, not those that are diagnosed, but just coping and dealing with situations. And a lot of people want to understand things and also to be understood. So you really gotta get into deeper with people. You gotta start feeling the humanity of people instead of just writing them off as another patient, customer, or number.
And the last one is employment. Employment is key, because with employment you help everything thrive. With the economy and the way that it is today, you know, the problem is oh, how do we get the economy to progress? One thing is that if more people had jobs, it would be no problem. It wouldn't be a recession, it wouldn't be anything like that. And that's exactly what these people are looking for when we go outside and we see a person walking down the street. Now, me, myself, personally, I'm gonna be quite personal. I don't even have a job right now, but that doesn't mean that I don't wanna work. But that doesn't mean that we don't wanna work. And I'm tired of being a stereotype and a statistic. Because there are a lot of people out here who really don't want to work. Like we were talking at the table about social services that help someone that is an addict before they help a single mother who's really trying to provide for her kids and can't find any help. And to also piggyback on what you said earlier, the young people are exactly what they are. They're young, they're sponges. They only do and mimic what they see. If they see a drug dealer outside and he's driving a Mercedes, he's got a big house, that's
Daddy ain't making that money,
he's gonna do the same thing. So it all starts at home. You know, as far as kids, like the song says, they are our future. And that's where we need to put everything into. Because I can sit here and say, oh, I'm 80 years old, Medicaid and Medicare is not doing what I need them to do, but guess what? You about to go. What about the guy that's coming in before? What about the guy that's coming in after you? Oh, excuse me for saying about to go.
Seriously, no offense to anyone, but children are the future. You know, as our table was discussing before, you wouldn't have messed up children if you didn't have messed up adults, and it's an endless cycle. Messed up children growing to messed up adults, and they have messed up children who become messed up adults. A lot of the underlying problems in the communities would lessen with a lot more employment to people in the communities, those who want to work. You know, as we were discussing before, drugs will always be a problem because there's supply and demand. But there would be less drug dealers if there were more guys in the job working. Like you spoke on earlier, a lot of young guys out here don't want to do it. They just need money. They need income. They need to feel useful. They need to feel like a man. And another thing, as a community and as a people, we need to stop belittling our men and our women. You know,
And stop blaming.
We should be raising kings and queens, not niggas and bitches. You know, that's just flat out. And everything that, like he said, everything that we do, our children see, you know. So you can't blame the community, the TV. Bottom line, it starts at home, you know. And still speaking on the topic of employment, a lot of these parents were employed like they wanted to be, making the money that they should be. Their kids wouldn't have to worry about, their 14, 15-year-old son don't have to worry about, I need some new school shoes and my mama can't afford it, you know? daughter wouldn't have to worry about, oh, I need feminine hygiene products and my mother can't afford it. You wouldn't have them becoming 18, 19-year-old young adults turning into 30-year-old adults who are still doing the same thing that they were doing when they were 13, 15. Messing with this dude or this chick or this thing for some money, you know, because we all need it. So why is it not being provided to everybody? At least the opportunity.
Everybody needs to be involved. That's basically the bottom line. You know, fingers are always being pointed at, oh, if you did this, or if you did that, if you did that. What we need to do, community is about unity. That's the key word. Community consists of two words, communication and unity. There is none. So with the people here, we have to find out how we can start that back in our community to get it thriving and proceeding to do what it is that we wanted to do, and that's survive.
And I think on the employment tip, we should be attacking these jobs, not physically, but in a way that, like I was saying to them, there's a bunch of jobs out here, but there's so many jobs that's hiring, there's so little people being hired. We need to attack them in the way they go about it. Me personally, I've been through experiences where it wasn't the job, it was the third-party resources they're using for a background check, making me look bad, you know? And these are the things that we need to attack. These are the things that we need to come at. We need to come at these companies and these businesses who will accept our money, but won't accept us as an employee. And there you have the priorities.
You guys at your table want to add anything?
Hey, don't tell me to shut up.
All right, good job. Don't forget to write down on your cards if you're able and you're willing to be involved with us. We need your name and contact information. Let's go in the back, right? Either one. Okay, you're together. Okay, come on up. Which table is your table? Raise your hand if you're with. Okay, got it. This table in the middle. Come on up.
Proudly representing the older generation and the younger generation.
Which is which?
Right.
Thank you.
Okay, so I'm sure we're going to allude to a lot of the things that people already mentioned, but I'll go ahead and start with the physical assets and attributes bucket. And what we found the most important within that one in our table was social support. And by that, under that, we put rent assistance, energy assistance, food and nutrition programs, as well as increasing accessibility to healthy foods, transportation, and housing assistance as well, and ex-offender reentry programs we thought were very important. And as far as economic assets are concerned, youth development and job training and programs that combine the two, so that when kids are going from middle school into high school, hopefully transitioning seamlessly into a job.
The other thing we talked about, I guess it would come under communication, is letting everyone know what is available. Finding out what you need in the community. We talk from all age groups. Our youth need to, under youth development, need to know how to access jobs. I mean, what are the skills that they need, life skills, what do they need? And then we need to know who is available to teach them those things, etiquette, business etiquette, what to wear, what not to wear, what to say, what not to say, safely use Facebook and social media and all those other kind of things you need to know when they go to do your background checks and all those kind of things, so that they can be successful adults. For our adults who are working, we have to go to work every day, not old enough to retire yet, they need support also, because they're getting many of us are in the middle, taking care of our older people, taking care of younger people, not enough money, and needing to retrain as jobs are changing. And so what's out there to help us? Like, I know a lot of people need computer literacy. You know, if I knew how to type, I mean, I learned how to drag a mouse under threat of penalty of death. You know, rulers and everything. If you don't learn how to click, we're not going to let you eat, you know. But I learned how to do it because I needed to keep going in this society. So give the middle-age group, you know, that middle age is from 24, I guess, to 65. Yeah, let's do it like that, okay? All right, that'd be middle age, all right? All of us are still out here working and contributing a lot and help support us. You know, we want to know where the fun places are and where the work places are and communicate that to us. And I'm sure there's a lot of things to do over in East Baltimore. The other thing is for our older generation, baby boomers on up, yay? Okay. We have our needs, we want to age in place. We don't want to be put in homes, in little apartments if we don't want to be in little apartments, okay? Some days I want to be in a little apartment, some days I want a big mansion, okay? But wherever I want to be, I should be able to be active and still contribute. My mind is still good, even if I can't jump, skip, and hop as well as I used to. So we want to support. How do I physically support for keeping my home so I can stay in and be comfortable? What resources are available? Get me to my doctor appointments, all right? Get me a kind of, you know, I can't get in that little Corvette. I gave up that dream, it's too low. I can't get in it and get out of it gracefully, okay? But get me the kind of transportation I need. Public transportation needs to come for the people, and I think this is for all age groups, kids, older people, everybody. Public transportation, we need to know when that bus is coming or that train or whatever, and have it actually come and serve our community. We don't need to wait 2 hours. Oh, don't let me get me started on that. But the communication among and intergenerational, what I'm hearing is intergenerational communication, because a lot of things that I know, you need to know. A lot of things you know, I need to know. Let's share this information. And we thought how we might do it is by creating a resource packet, something that is typed up, printed for those of us who still need that kind of thing, all right? And also having it digital. Let's use technology to give us easy and quick access. That's a great equalizer, is our technology. We were told that if you don't have computers at home, you can go to the library and different places where someone will help you. Yes?
30 minutes. And if you're not computer literate, not up on it, or you just learning, sometimes you sit there and read what's up on that board right there, the instructions how to operate the computer. The time is up because you got 8 on students and regular librarians that comes there. So you're still out. They need to make some kind of program where you can go in there and really have the time to learn or how they're going to
And the thing is, we need to spread the information about what programs are available. I went to school in a program that apparently had been around for Baltimore City residents for about 3 or 4 years. I was one of the last classes to get in, you know, to be trained. I can program and all kinds of stuff now. I don't want to, but I know how to do those things. But I didn't even know that program was available. And we need to get that information out because the federal, the city, and state receive money to teach us all how to do the things we want to do. So we need to communicate that.
I wanted to say that the Enan Pratt Library gives free training on this in the various branches all over the city, and also for the seniors.
Could you just repeat that so everybody could hear?
I said Enan Pratt Library and all of their branches downtown have free training for computer. All various stages from beginning up to whatever the latest thing is. I can't keep up with it myself. And so does the Waxner Center for seniors. There are a lot of places you can get training, free training. And a lot of people don't maybe know about it, but the library sends out free newsletters every month for everything that's available through the Enan Pratt system. So there are a lot of things a lot of people don't know, and that's one means of communication. That the newsletter, and if you live in a district that you have a pretty good counselor, they have resources available. In the Maria neighborhood, we have Senator McFadden as our 45th district senator, He sends out newsletters every month. Various things.
Yes, so what we were talking was saying that someone needs to help us create a database. Because, everyone knows a little bit about things, but something that someone who's, technologically wanted to do that, create a database so that churches, community associations, whatever group can easily access and keep it up to date so that everyone will know what's available in our community. Why we chose these assets as priorities, each of us at the table looked at what actual needs are in our communities. My neighborhood is mostly older people, called senior citizens. I'm the youngest. Most of the people that I interact with are in their 80s. And so they're very vocal, very active, very much contributing to our neighborhood. And so I thought about the things that we needed. Other people at the table talked about, what they saw needed. So each of these things, I think are actual real needs to be addressed at this particular time. And are we interested in how we're going to use this data? We're going to share it with everyone and talk about it, and we're willing to network. And my table, is it unanimous that we're all interested in working on this? I am.
You guys want to add anything to what they've said? Thank you. Great, okay, we got 2 or 3, you guys want to be next? All right, we got one table, then I think Angela, your table in the back will end up with Angela's table. Margie will do it, okay. 3 more tables and we'll be all done, guys. Oh, don't forget to make sure you see Pam. If you haven't filled out that, so you get your $50 one at a time, you can go back there and see her. We're almost done. Oh, sorry.
And also, please don't take your cards with you if you're leaving, because we do want to collect them at the end.
Yeah, we'll collect them.
Hi everybody, I'll keep this quick, I promise. For our first question, our 3 priority assets, we decided that physical assets, voluntary associations, and individual assets are our priorities. To give some background, we chose physical assets because of the quality of life. We feel if you improve your quality of life, you'll do better in community, you'll do better helping other people to do better. For voluntary associations, we looked at all the things they have listed here. Basically, all of that is important to helping build a community and keep a community going. And lastly, individual assets. If people realize what they can bring to something, they'll feel better about themselves, they'll be more involved, they'll stay involved, and it'll help bring other people to be involved and stay involved. And it's an ongoing cycle. For question number 2, why do we choose those assets and priorities? I basically just answered all that. We feel that these are the basis of generating a better people, a better community, a better everything. You start there and you build upon it, and that's how things get to a higher level. And lastly, how do we use these data for improving our neighborhood? We can use these to help educate people on issues that we see are ongoing in our neighborhoods or in outside neighborhoods or wherever. And by teaching people, people can reach out to other people. Basically, everything is about teaching and educating other people, and it only gets better from there. And that's basically it.
Great. Did anybody at your table want to add anything to that? No? Okay, good job. What did we say? Oh, in the back. We said in the back, and then we'll end up with you guys. Come on.
Okay, the first question, what are the 3 priority assets that we want to focus on? Well, unfortunately, we had 7. 1 was employment, second one was health, 3rd was housing, 4th was safety, 5th one was reentry, the 6th one was seniors, resources for seniors, and the 7th one was transportation. Why did you choose these assets as priorities? I work at the Men and Family Center. So these are the areas that people always come to us for. So these are high priority for us. And how did I think this information would be helpful to me or to you? I think that by targeting these areas, such as unemployment and employment, which is very, very crucial right now in this economic distress. I see that right now, a lot of people are looking for employment. Whether it's at Hopkins, they have their criteria, the state has their criteria, and unfortunately, if you don't meet that criteria, you're not going to be employed. So we need to have access to job training, pre-employment training, referrals, and get the person established so that they have the skills needed to get those kind of jobs. Health. I think that health is very important because if you don't have health care, unless you have an emergency situation, you shouldn't really be going to a hospital. You're going to generate bills. You don't have a job. Can't pay those bills. Housing. If you don't have a house, unfortunately, the Section 8 program is on hold. You got Mod Living on hold. St. Ambrose Housing has cut their programs. You had the EBDI relocation program where people were relocated. We would like to know what the renter's experience was. Safety. Safety as far as our relationship with the police department or how we view the police department. So the perception of what the people thought is very important to us. Reentry. Unfortunately, reentry, when you come out of jail, you don't have housing, you don't have health care, you don't have resources, and you're already targeted. You have big bullseye on the side of your head. So if you don't have access to resources that are going to meet you where you are, and I'm going to brand Men and Family Center or Charm City Clinic, we meet you where you are. We take you where you need to go. We connect you with the services that you need. But we need more resources like that. So we would like to know what the data said as far as other resources that are available to reentry population. Resources for seniors. Unfortunately, they're so limited. So we were looking at, are there employment opportunities like Green Thumb? Or are there training services, like she said, the library? But what if we can't get to the library? We should have more services within the community that are accessible by location, by zip code, where you live at. Transportation. Yes, we have the MTA, light rail, shuttle buses. Unfortunately, they're not on our time. We're on their time. Because unfortunately, it's better for them to be late than it is for them to be early. So what do? We need to look at how people are getting around so that data would help us better serve our community as a whole. Another thing was communication. I think that as stakeholders or community associations, we should learn how to improve the communication with our general public in our communities that we serve. Whether it's the word of mouth, emails, door-to-door, media, community calendars, newsletters, you name it. We should also take the time to link things onto our websites that people can get access to and connect with one another so that the services on a wide scale in East Baltimore would help other people. And I will be interested in working on this project. Thank you.
So just to add on to what Quandra had to say, as you can see with all the many things Quandra had to say, kind of how we focused on it was what have been people's experiences with all these different issues. So we were interested in looking at the data to see with all these different priority areas, what it's been like for people, everyday people in East Baltimore to deal with all these things. Whether, if it's health services, what's it been like to go to all the different places to get health care, and how can we use that information to improve what's out there. I'm sure some of y'all here, when times have been tough, you have to get something done, and all of a sudden you have to go 5 different places to just get one simple thing done, whether it's get your BGE turned back on or get money and get a prescription or something like that. That's what we hear all the time, that it takes forever to get things resolved, and we want to use the asset information to help fix that. To give some people some more information about an effort that's been, just a real plug real quick, going underway on that regard. For over a year and a half, a bunch of residents of East Baltimore have been working together to develop a project for neighbors to help people, neighbors who are assets in the community, to help people stay healthy. Just this month over at the Men and Family Center in the clinic, we're starting to recruit individuals to be, we're calling them neighborhood navigators, to go block by block to help people with their health. This is something that over the past year we've gotten the Hopkins Community Health Partnership to fund after a lot of effort. Anyways, we're looking to recruit 30 individuals from East Baltimore who live in the area from Orleans up to Preston and Washington over to Curling. If you have any individuals in mind who you think might be real good at just helping neighbors, people on the block, keeping them aware of resources, making sure they have medications, part-time, get a stipend every month for it, and just a real sort of natural healers. We're going to have another information session tomorrow night at 6 p.m. You can find me after the meeting for some more information, but please, please, we encourage people to get involved. Oh, I'm sorry. At the Men and Family Center, 2222 Jefferson Street.
Anybody from that group want to add anything?
Yeah, I wanted to add one thing. It was lead poison intervention. And the data you shared with us tonight, the numbers have increased. This has been a generational problem, and it affects the long-term outcome of our youth, young adults, educationally, socially, even when it comes to juvenile statistic and reentry and recidivism. So this problem really needs to be addressed. It's generational and it lasts for decades. So I just thought I'd mention that's another asset we need to have in our community.
All right, all right. Let's thank that group. All right, let's, I forgot your name? Margie. Margie, come on up, Margie. Oh, I'm sorry, there was a question, I'm sorry. Come on, you can still come on, Margie.
I just wanted to address that, Phyllis. Actually, last week was National Lead Poison Prevention Week, kind of put out there by the CDC, Center for Disease Control. But the organization that I'm with, the Green and Healthy Homes Initiative, is the same thing as the Coalition to End Childhood Lead Poisoning. So there are still grants out here in the community. I know I've talked to a lot of you already with some of the initiatives that we have. One of them is actually a childhood asthma prevention grant, and it focuses on families who have children between the ages of 2 and 14, identifying asthma triggers, removing the asthma triggers from the house. So some of the triggers that are identified are things like the lead paint, or the resulting lead dust from having lead paint hazards in the home, as well as asbestos, as well as appliances that aren't functioning properly, which actually segues into another aspect of the grant, which is energy efficiency and weatherization. So there are definitely resources out there to still address lead poisoning prevention.
That's prevention, I'm talking about intervention. Once they're affected.
Well, the problem is that CDC's budget was slashed back in 2012 from $22 million to $2 million. And that money was going all over the country for testing and the interventions that...
No intervention.
I know, because the money's not there anymore. That's Congress. That's the issue with Congress right now, yeah.
But that's why I need everything.
Yeah.
This is needed. Our people go to jail generation after generation. Misdiagnosed or not diagnosed. And as you can see, they drop out of high school, and East Baltimore is prevalent. And we got, I know, my brother, he's almost 50. So I know we got people in that family who've experienced mental health issues and some health problems in that area. So I'm just saying, it's just been long going. It really needs to be addressed. Thank you.
Good evening. My name is Margie Fleming Brinkley. I'm representing the Environmental Justice Partnership as well as the Berea community, which I want to give props out to because we're here in great number. And that as part of, as a priority as far as being involved and being a part of the process. And I have some of my board members here from the Environmental Justice Partnership. If I may borrow a quotation that I learned last week, if you're not at the table, then you're part of the menu. So I would like all of you all to come to the table. And all the things that have been previously said, ditto, ditto, ditto. I echo all that and then some. And I would like to say as one who's, in some places you would say that I'm a senior, but I don't think I'm on my way out, I'm on my way up. I'm on my way up. And on my way up, I'm trying to bring those with me, leave a legacy, share the wisdom. Because we have to cherish our past as we embrace our future. Each one, reach one, teach one. And one other thing, preservation, especially, this may go for other communities too, We have a very historic area, and each community has its own story to tell. So preserve your story. God bless you.
Anybody at your table want to add anything to that? Good. Okay, Roxy.
But I think it's one of the things that she raised there, and anybody who knows me and what I've been saying for years and will continue to say, is that if you look around this room, how many youth do you see in here? How many youth? And I don't mean, and I'm afraid that children, but I mean even our babies. There's a place for them to be in these discussions. There is a place for them to be in the planning sessions. We have to stop thinking that we have all the answers. And not only that, if we're as adults are the only one in the process of making decisions and having the discussion, the next generation, and then the next generation, and the next generation will continue to face the same problems. Whatever we do has to be a multi-generational approach. And without that, we're just kind of blowing in the wind. We have to get the youth involved. And I mean, not just one time for one instance, but it has to be an ongoing process where they are a definite part of the process.
I couldn't agree with you more. I think it's worth mentioning a couple of things, however. As part of this work, last year with Henderson Hopkins School, the young people, your school, undertook a project where they did a photo voice project. They took photographs and they interviewed people in the community on assets. And we have that as part of this information. And one of the things that we've talked about and that I really am excited about is that with the opening of the new school in the library, we can use those photographs and these stories to tell a story here. The second is over the summer, we engaged the young people in the summer program at Jane's House up on North Avenue to do a similar kind of thing. And this year, we're looking to do this again. So I think the point you make is terrific, and we need to engage young people in ways that really engage them.
On an ongoing basis.
On an ongoing basis, and photographs and interviewing, for them to interview people in the community is one way for them to hear what the richness of the community is.
And one thing that troubles me is the Lucille Gorms and the others who have come and have gone. Do those kids even know who they are? You know what I'm saying? Were they sitting at their feet and hearing the stories and hearing the life that they lived? This is what these kids are missing.
And that's assets. Those are what make this community great. And those are the stories that young people do need to hear. We all need to hear.
Well, my friends, we've come to the end. I want to personally say thank you to all of you for coming and for staying. It hasn't been easy over the years. Tonight hasn't been easy, but it's been worth it. We're making progress, and we want to continue working with you. Make sure that either Amy, raise your hand, and where's Sam? Sam, are you around? Give your cards to either one of these two ladies. We need these cards. And those of you who are willing to work with us, we're going to be reaching out to you. Thank you so much. Make sure you see Pam and get your $50 before leaving. And stay in touch with us. We want to stay in touch with you. Thanks for coming, and we'll see you later.